good evening, everybody that is tuning in and our panelists. My name is Tennille Lafontaine. I am moderating our chat tonight, and we have 4 physicians in this province that have given their evening time to us above everything else that they're doing in their day to answer some questions on behalf of parents and teachers and grandparents here in Saskatchewan, and on behalf of Safe Schools Saskatchewan, who put this webinar together. I'm going to introduce our panelists here quickly, and then we're going to jump into these questions that have been waiting from members of the public. So tonight we have with us Dr. Ayisha Kurji. She's a consultant, there she is waving, and consultant pediatrician and associate professor of pediatrics at the University of Saskatchewan. She specializes in many areas, including general pediatric clinical testing unit. We have Dr. Nazeem Muharjarine. There he is, professor of community health and epidemiology in the College of Medicine. He's one of the leaders of a Canadian research network on coronavirus variants called COVARR Net. Then we have Twitter famous Alexander Wong. There he is, an infectious disease physician and clinician researcher with the Saskatchewan Health Authority. He works in Regina and throughout southern Saskatchewan. Last but not least, we have Dr. Karen Leis, a clinical assistant professor at the University of Saskatchewan. Give us a wave, Karen. There she is, at the Royal University Hospital in General Pediatrics. So thank you to the 4 of you for joining us tonight. I'm going to just make this an open discussion. Feel free to jump in with your answers. If you want to follow up with an answer, raise your hand and I'll pause to allow you to do so. We've got about a dozen questions to get through. We do have the chat open that people that are listening in right now and tuning in will be able to add some questions too. So to get started, I'm a mom of 3. I have kids getting ready for school. We've got school supplies purchased. Those supplies include masks, which have been a topic of discussion, of course, all summer long, and especially within the last few days with school districts sharing their plans. So the first question comes from a parent that says, I'm concerned about breakthrough infections for vaxxed teens who are sitting in unmasked 50% vaxxed classrooms. This parent says, I don't know how I can ethically allow my child to be exposed or infected in a classroom without protocols. I'm going to ask our 2 pediatricians, maybe this one first. How can I reconcile this dread with the benefit of being in a classroom right now?
You want me to go first?
Sure, go ahead.
Okay, it's such a good question, right? I think as parents, I'm a parent myself, and as pediatricians, we talk about this a lot. What is the right way to go and what is the right thing? We do know that masks do help, right? We also know that vaccines absolutely help protect you from being infected. They're not perfect. So there is still a chance that you will have your child exposed to infection if they're in a classroom or any situation where they're shared indoor airspace and there's not masking. So I would strongly encourage wearing masks, having those conversations with teachers to try and promote mask use as much as possible. It's a really tricky question, right? When you think about, I'm putting my child in a situation where there's risk. And I think it's always about weighing the risk and the benefit, right? So yes, there is risk with COVID infection. We also know there's risk if you choose not to put your kid in school, right? So you know your children the best. We know that some kids, I'm sure Karen would say the same, that we've seen lots of kids who struggled in the last year who weren't in school, right? Or even kids who did struggle with school, but the mental health impact of the pandemic has been huge. So it's about weighing that risk and what is the bigger risk for your child. The risk of the COVID infection, especially if you've chosen to vaccinate your child, you've done an awesome job. You made a great choice to keep your child safe. So weighing that risk versus the risk of other things that might happen if you choose to make a different decision.
If it's okay, Tennille, I'll just add to that we know, because Ayisha was just talking about vaccination, we know from COVID vaccine or Pfizer trials that, the efficacy of a vaccine in an individual in preventing infection is about 95% after 2 doses. Real world data is close to that, probably 85 to 90%. and that includes asymptomatic infection. And so I think, putting your child or having your child go to school, even if they might be in a situation where there are no masks, if they're double vaccinated, the chances of them getting COVID are very small, and the chance of them getting severe disease from COVID-19 is even smaller.
Go ahead. Dr. Wong, go ahead.
You don't have to call me Dr. Wong, Tennille. Alex is fine, please. So just to add to what Ayisha and Karen said, and I think this is going to be a sort of a theme of the evening. I think we all, for better or for worse, kind of have to start to work on coming to terms with the fact that we're not probably going to be able to protect ourselves and our kids forever from being exposed to COVID. And COVID has changed so much over the course of the last, year and a half. We're dealing with a completely different virus than we were March of last year. And the contagiousness of this Delta is just so significant that it's honestly not really realistic to believe that you're not going to get exposed at some point. So the goal kind of has to change for those of us in rich countries that are fortunate enough to have access to vaccine, to a different sort of strategy where, the focus really needs to be trying to, kind of expose people, when they've got 2 doses of vaccine in them. Because as was mentioned by Karen and Ayisha, again, your overall risk when you're a kid or a teenager of getting severe illness when you get COVID is very, very low to begin with. And if you got 2 doses of vaccine on board, that risk goes down to almost nothing. I mean, you can't completely eliminate risk altogether, but it makes the risk benefit much more favorable to be in schools. And so that's the goal. And that's why it's awkward right now with kids under 12. I've got 3 kids under 12 right now. And, it's awkward because, I'm kind of feeling this tension around do we try and, just, again, their overall risk, even if they are exposed to COVID, is minimal, relatively speaking, but do you really want to be that one? So I think that's going to be an ongoing theme of this evening that we're going to talk a bit more about over the course of the next questions. Thanks.
Maybe I'll just add as well, because it's the first question. And, I think, first of all, I just want to say that I also have 2 children, but they've left home. And a topic of conversation around this time of the year, just days before kids go back to school, is how fortunate we are right now that we don't actually have kids who are school age. I just want to say that because that is a conversation that I'm having with my wife pretty much often, and more often than we want. I think back to the question, I think masking is important. So I'm not going to reiterate the whole thing about vaccination and so on. I think masking is important, but that is not the only thing that is important. It is one of several things that we have to do in order to protect. Vaccines, are right at the top to get your 2 doses when you're eligible, and wear a mask and distance as much as possible. And it is difficult and challenging in a classroom situation, in a school, playground, and so on, but also ventilation in a classroom, and also the community prevalence, of the disease of COVID-19. We'll get to all of this, I think, a little bit more as the evening progresses. But I think the key message here is it's not just only one thing that matters in terms of keeping kids and their families and all of us protected. It is several things. It is that Swiss cheese model, or it is kind of layered protections, that we have to be thinking about, not just only one thing.
Very good. Yeah, parents have a lot on their minds right now. You've got a lot of layers to think about, that's for sure. I'm going to remind everyone that's tuning in, go to the chat, add your questions. That's where our moderators can go ahead and give them to us to add on to what we're talking about right now. So we are still taking questions. We'll add that in. Okay, here's a